Thank you, Mr. Speaker. I ran for office because I wanted to solve problems and help people. Because my parents, who grew up during the Depression, saw the best of government and the worst of government. And the best of government looks at a problem and says, how can we come together to fix it and help people who, through no fault of their own, need help? And part of the point of the Affordable Care Act, and I wasn't here when it passed, but I was a state legislator. I've been a patient. I've been the child, parent, and spouse of patients. I've been on hospital boards. I was on a Medicaid provider board. And those experiences showed me circumstances change. And the Affordable Care Act was intended to ensure that more people got insurance, because insurance is supposed to pool the risk so that people who need access to health care can afford it. Because all of us are one accident or illness away from economic devastation. That's the bottom line of what we should be focused on. And the reason that you put deadlines in place or expiration dates in place is so that you can come back and say, have the circumstances changed so that the solution needs to change? And rather than saying, well, you put the deadline in, maybe we should take this opportunity to look at what's changed in the past 5 years. The costs of everything, including health care, continue to go up as the cost of child care goes up, as the cost of everything has gone up in the past 5 years. That's because technological advancements, which cost more money, have allowed better care. Because a population that is living longer and has more chronic diseases and more complex healthcare needs costs more money. Some is because of administrative costs, because the people who provide the care often were providing it at wages that didn't allow them to meet their own needs, because drug costs have gone up. And yes, we need to come together and find a solution for the rising cost of healthcare, but in the meantime, we can't just let millions of Americans go uninsured, because that is guaranteed to mean those uninsured who will still get sick, they'll come to the hospital when it's too late. They'll come to the hospital when it's too expensive to treat them, or more expensive to treat them. There'll be more uncompensated care that'll put even more of a strain on the healthcare system. And if we don't seriously look at that and address both the long-term issue and the short-term needs, we're going to leave a lot of Americans behind. I spent August particularly talking to rural healthcare providers, not just in my district, but all across Virginia. And what keeps them up at night is the fact that whether it's because of the Medicaid cuts or whether it's because of the expiration of the enhanced tax credits, they're going to see more uninsured people coming into their doors. Whether it's the dental clinic in Abingdon, where 80% of their patients are Medicaid and the rest are uninsured, and they have a waiting list of 2,800 people who, before that clinic opened, had to wait once a year for a dental clinic to come to get basic needs or dentures. Or whether it's the academic research hospital that says, I provide more uncompensated care while dealing with a workforce shortage, or it's the long-term care facility that can't compete in a rural area in Waverly, that can't compete for workers with Amazon. It's a complex system and complex reasons why the costs are high. But while we fight over how to lower the costs, we cannot leave 17 million Americans to say, if you get sick, if your child gets hurt, you're out of luck. I yield back.